Hi, good morning, good afternoon, and good evening. I'm Amanda Glassman. I'm a senior fellow here at the Center for Global Development. Today, we're going to kick off one of several events on global development challenges on the sidelines of the World Bank and IMF spring meetings. We're talking about taxes during the recovery from COVID-19, but all of that is happening obviously in the context of increases in food and fuel prices, the rise of inflation, debt distress. There's a lot going on in the world now. Altogether, this has meant that for many countries, there has been a drop in revenues and growth and generating large budget gaps. So the question of corrective taxes levied on harmful products such as tobacco, alcohol, or sugary sweetened beverages, what we'll call health taxes for short in this session, seem like a tangible and feasible immediate measure to boost revenue while supporting better health. Earlier work has shown that health taxes have the potential to generate an estimated 0.6 to 0.7% of GDP in short-term revenue. But current levels of corrective taxes are equivalent to only about 1/3 of the indirect economic costs. This is just the productivity losses associated with the mortality and disability that are related to the consumption of these products. So health taxes would need to increase by about 1.5 points of GDP on average, and to be implemented at those levels by many more countries to be able to correct for the losses. To give you one example, in Pakistan, a country with a very high smoking rate of approximately 20%, tobacco use is associated with about 160,000 deaths a year. Raising tobacco excises on cigarettes about 25 cents could actually result in fewer smokers, many more lives saved, and an increase in the federal excise duty revenue. So there's quite a bit of consensus by analysts on the effects of these taxes, and both the World Bank and the International Monetary Fund have been active in global health tax policy work, especially for tobacco, and more recently at the IMF, sugar-sweetened beverages, and have conducted, of course, multi-sectoral analyses of tax reforms and commissioned policy papers. But despite this, our research staff, Chris Lane, a non-resident fellow at CGD, found recently that IMF programs' focus on health tax measures has diminished in number and strength since the beginning of the COVID-19 pandemic. Now, in some ways, that's understandable because the idea was just to get money to to countries that were facing a lot of external shocks and dealing with a very volatile economic situation. But now is the time to revisit some of these moments. I think if you look at the international financial institutions and what's happening in low and middle income countries' economies, there will likely be more policy-based lending, more budget support, more IMF programs, more Article 4 consultations. So there's really an opportunity to revisit the idea of health taxes in the context of recovery from COVID-19. In the coming weeks and months, we'll be convening some other events around this topic of health taxes, including an upcoming webinar with the Asian Development Bank, so please stay tuned. And today, we're really fortunate to be joined by a great panel. First, Mamta Murthy, who is the Vice President for Human Development at the World Bank, Sanya Nishtar, a senator from Pakistan, and until recently, the Special Assistant of the Prime Minister on Poverty Alleviation in Pakistan, Mario Mansour, who's the Division Chief for Tax Policy in the Fiscal Affairs Department of the IMF, and Karambu Mutwara, who's from the Policy and Tax Advisory Division of the Kenya Revenue Authority. Before we get started, I'll just remind everyone that you can submit questions for our panelists to events@cgdev.org. You can tweet them to us at CGDev, or you can use the hashtag CGDTalks, or even below the YouTube stream. So let's turn now to Mamta to get started. Our recent work has shown that governments around the world have been a bit less active in promoting corrective health taxes during the pandemic, despite the evidence that non-communicable disease associated with these products' consumption is related to increasing the risk of severe COVID, for example. And as we transition out of this emergency phase related to the pandemic, hopefully, can you tell us a little bit about what the World Bank is doing to step up efforts to promote corrective taxes to support healthy populations and revenues? And where do you see the most potential to affect human development?
So thank you, Amanda. It's great to be at this event. As you mentioned at the outset, today is the first day of the World Bank IMF spring meetings. And this is a very opportune moment to be discussing this very important issue of health taxation. So let me say that going into the spring meetings, what we are very concerned about at the World Bank, you already talked about the growing uncertainty, especially how it affects the prospects for economic growth in low-income countries. But as the Vice President for Human Development, what I've been emphasizing from a human development perspective is that this pandemic has been the biggest setback to human development outcomes in living memory. And perhaps the biggest setback is coming from the closure of schools, which has, which has been long, and as a result of which children have learned little during the pandemic. We had actually simulated at the start of the pandemic what the impact would be, and now that children are coming back to school, we are seeing the learning losses that have occurred because children have been out of school. And that is a big contributor to the setback to human development. Now, how do countries recover from this setback? I have specifically not chosen to mention the setback to health, though obviously that is huge. There is the deaths from COVID, but also from related causes. And there's the postponed care that we are very worried about. Postponed care in HIV, TB, we're extremely concerned about the postponed care in TB. But also, I think what COVID-19 has done is put a spotlight on the other NCDs, which have actually contributed to higher death rates, right? We know that obesity has been associated with higher death from COVID. Now, in this context, what we've been saying, and we will say to country delegations, is that health taxes can be a part of the solution. They can both contribute to better health outcomes, and they can also contribute to raising revenues for investments in human capital, which are sorely needed. Now, at the World Bank, we have a new health tax program, which is a program of analytical and advisory work to provide technical support to governments that are thinking about health taxes. This is a program that is already helping developing country governments. I want to just give a few examples. I won't mention Pakistan because we have Sanya coming up after me, but let's take the case of Ghana. We are in conversation on a public expenditure review. Ghana spends much less than its peers on the public side on health. This is related to low revenue mobilization and low prioritization of health within the government budget. And as a part of that conversation, we are supporting the Ministry of Finance and thinking about how health taxes can help with further revenue mobilization. Nigeria is another example. We provided technical support to the government of Nigeria. And as you know, they introduced a tax on sugar-sweetened beverages earlier this year. Indonesia is a third example of a country that is thinking of tobacco taxation, and we are supporting through technical work. Now, I want to just say three things about these taxes, because very often the discussion about these taxes with ministries of finance is from a revenue generation perspective. I would argue, and as the World Bank, we argue that we really need to think about the health implications of these taxes. And if you like, the revenue is a nice corollary. And thinking through the health implications is complex. First of all, there's the price effect and of these taxes, and we have to think about cross price elasticities. You know, you can tax sugar-sweetened beverages. It doesn't mean that overall sugar consumption goes down. In fact, sometimes taxing sugar means there's an increase in fat intake, and that's not what one would want from health outcomes in the long run. So that's one aspect of things that the analysis needs to be thought through very the analysis needs to be conducted very carefully in order to have a package of taxation that supports a better health outcome. The second thing I would say is that it requires very close conversation between ministries of health and ministries of finance in order to have that broader and more holistic picture. And the final thing I would say is that there is a concern that these taxes can be regressive. And so I think the communication around this taxation needs to be done very carefully. I think the communication needs to relate to health outcomes. And that's why the design of the tax needs to be one that supports better health outcomes. I would also propose that there be some thinking done to soft earmarking of the resources that are generated through this taxation, soft earmarking for human development outcomes or better services for the lower deciles of the population. I think this would also, make the proposition more palatable. So in short, we have a new health tax program. We're in dialogue with many countries. We do think there will be some take up, but the design and the communication needs to be very carefully handled for effective implementation. Back to you, Amanda.
Yeah, absolutely. That's exciting to hear about the new program, and hopefully it will be engaged in a lot of the new lending that I know that the World Bank will be undertaking during this period. So let's go to you, Dr. Sanya. According to the Social Policy and Development Center in Pakistan, we'd already talked about tobacco use being associated with a very large number of deaths in Pakistan. Cigarette prices remain among the lowest in the world. So it makes sense that you might think about tobacco tax or increasing tobacco taxes as one way forward. There's obviously a lot going on right now in Pakistan. Can you tell us a little bit about, what you see as the strategy ahead for government in this space, and what could international organizations do to support local organizations that have been working for many years on this issue, doing very good analysis? How do we keep it on the agenda? What role could it play?
Well, thank you, Amanda, for asking me to be part of this very exciting panel and for catalyzing a very timely conversation. Let me just make 3 quick points about what you've just outlined, perhaps a little more broadly compared to Pakistan, and then we'll hone in on the Pakistan situation, because we know that the burden there is very high. There is this huge unmet policy gap. But I think first we must understand that even when there was appetite within governments to act, COVID has been a great disruptor to the regular policy agenda. And this is not just specific to health. I mean, prior to early March of 2020, as a government which was there for the last 1 year, there were plans, there were frameworks that we wished to implement, there was consensus building, there was a deep dive into evidence. And then came COVID, and everything was derailed because we were just focused on how to get through with this, with that problem. So the health systems overhaul, and subsequently the massive effort that was put in place to set an implementation engine to vaccinate an entire population, the 5th most populous country in the world, the mobilization of the very large social assistance. So our cabinet conversations, our government's focus was just focused around this. And I'm sure that this might be the case in many other countries. So, and I'm speaking very much from the Pakistan lens that, hey, we were a government in early 2020, 1 year into the seat, with many plans and we had to reprioritize completely. So from the health tax perspective, it's not that there was a lack of appetite. It's just that the competing agenda was really overwhelming. And of course, now that the dust is settling, this is just the right time to pull the threads and to start where we had left it back in March of 2020. Secondly, I think that the evidence on health taxes is very clear. We've known for a very long time that health tax, whether it is on alcohol, whether it's on tobacco, whether it's on SSBs, is the best buy. And also from the revenue and the economic perspective, as Mamta just outlined, and I quote her, health tax is part of the solution. We all know that. The question is, how do we set implementation into motion? And that is where the time-old tensions between the economic argument and the health argument come face to face. We've heard about this all our professional lives. This is nothing new. Now, and I feel, having been in the government for the last 3.5 years, I feel that one of the things we need to do better as governments, especially as international agencies also, but as governments especially, is to draw on empirical evidence and data much better than we do, to demonstrate that it's a win-win on both sides. It is a win-win on both sides, and you said it during your opening remarks, Amanda, as well. I mean, the revenue generation perspective, as well as the health side, both in terms of life saved, mortality, morbidity, as well as healthcare costs. And I don't think that we do a good job there at all, both as governments and as international agencies. So the governments need data that is specific to their context and setting. It is useful in a cabinet meeting to say that this is what a sugar tax has done in Mexico, or this is what a taxation has enabled in Thailand. But then the next question relates to projections in your own country, and that is where you're struggling for evidence, and and all you can quote from are some international league tables. So that depth of analysis, that I mean, even if it is from projections, is something for which the capacity is very thin at a country level. So I was very pleased when Mamta said that they're putting in place an analytical and advisory support framework for countries, because I think this would be enormously helpful. Because we don't have the methods, measures, the instruments to make those projections. And that is where international agencies can help enormously. And it is not just numbers, but it is also important to link it with ongoing policy making. For instance, after COVID, there is a huge realization in a few countries that I'm familiar with, that we need to broaden the social protection purse. We need to broaden the social assistance space. We need to create more policy space in whatever is bracketed under welfare, whether it is from the health lens or the education lens or the human capital development lens or the social protection or the safety net lens or the social insurance lens. And countries are looking for innovative financing instruments. This is very clearly an innovative financing instrument with a positive double edge. And it could very well have another sharp edge by making the case this can finance the welfare and the human capital building initiatives that the government envisages, that every government strives for. So I think, again, the analytical, I'd like to mention that the analytical and advisory support that the World Bank is putting in place would be enormously helpful. And thirdly, I just want to make a very simple point in terms of your question, Amanda, about what can international agencies do to promote health taxes. And the answer to that, as far as I see it, is very simple. For countries that are in IMF programs, or for countries that are recipients of multilateral loans, you just have to embed health taxes in disbursement-linked indicators. I'm not getting into the merits or demerits of conditionality, a hard conditionality, but if it was a question of simply achieving an outcome which was both advantageous from a fiscal policy perspective and a welfare perspective, then I think linkage of health taxes in process terms as a disbursement linked indicator would just do the trick. And I just want to, I personally feel that fiscal measures as an incentive are a very powerful way to change behaviors in institutions, not just at the individual level, but also in institutions. I recall when starting in March 2020, when I was responsible for a very large cash assistance program reaching out to 15 million households under a program called ESAS, which means compassion. It was called ESAS Emergency Cash. And we had a situation where the agents of the branchless banking system suddenly had their arms up in the air and said, well, you are paying us very little commission for disbursing this money in a very difficult environment. And you need to get us a waiver on the taxes. And I recall going to a cabinet committee, which was responsible for economic decision-making in me in this case. And I was told off. I was said, we are under an IMF program. We cannot give a tax waiver. And then we had to bring it as a special cabinet agenda to get the tax waiver improved. And that was absolutely fundamental to catalyzing those banking agents to operate in that very difficult environment. The point I'm trying to make is that fiscal measures, when properly designed, when contextually relevant, when carefully thought through, when backed by evidence, and in a real life context, can be very powerful. But data and empirical evidence is key. And I think it's time that we focused on that. So I'll just stop here and give you back the floor.
Thank you, Sonia. Well, that with your comments, I think it's a very good moment to pivot to Mario Mansour from the IMF. And I think you're raising the very important issue of political economy, of tax increases or waivers and things like that. And, you know, there's so much pressure now on fuel taxes. Of course, we don't want to cut fuel taxes or provide waivers on fuel taxes. For the same reason, we don't want to encourage more use of this for lots of reasons. But of course, politically, this is something that a lot of governments are under pressure. And I hope, Mario, I'll start with another question, but I hope you'll come to this issue of the political economy of these kinds of measures. But first, you know, we've seen inflation rising around the world. There's a risk, of course, that excise taxes on both harmful products and on fuel are eroded or reduced. And not just because of inflation per se, but because of the political pressures that leaders are under. So a question to you is, what is the IMF advising countries to do on these kinds of policies, especially on health taxes? And what role do IMF-supported programs and surveillance play in the discussion of health tax policies or similar? Thanks.
Thank you, Amanda. It's really a pleasure to be with the panel this morning. So let me answer your question in two times. One, I think it's important to say a little bit about the technical aspects of all this. And I will relate to some comments as well that Amanda and Sonia mentioned. And then in a second time, I will go to what the IMF is doing and what we can do more in this area. I think on the revenue impact, first, it's important to recognize there are two factors that affect revenues in situations like this. One is the design of the tax itself, and the other factor is how consumers respond to changes in prices. Now, on the design of the tax, as you know, there are two extremes in excises. Certain excises are entirely proportional to price, and therefore they will react, revenues will react to changes in price as a result. And you have excises that are totally independent of prices, meaning they are based on some measure of volume of consumption, liters of gasoline, packs of cigarettes, and the like. A third scenario, which is common, particularly in the area of tobacco, not so much in fuel and sugar-sweetened beverages, is a combination of the two. So that combination of the two recognizes that explicitly governments want to extract money from a tax when prices move, but at the same time, they want to address externalities by basing the tax on consumption volumes rather than prices. And obviously these two are not totally independent, but I think the impact on revenues is is fundamentally different in those three scenarios. Now, on how consumers react, and I think both Manta and Sanya mentioned a few important elements in this, is that if to the extent that the tax pursue primarily health objectives and is entirely based on consumption volumes, and the rate is set to reflect those externalities, then there is probably not much that governments can do. When prices move, consumers will reduce consumption, and the impact on prices will be a result of the reduction in volumes of consumption. If the tax is entirely based on prices, then you have the opposite effect. Now, one thing that is important to mention here, and it goes to your question of political economy of these taxes, is governments often are tempted to regulate prices during shocks. This is, for example, what we're seeing now across Europe in the area of energy prices, in particular fuel, and many developing countries as well in fuel prices and food prices. But that's a separate, that's another issue. Now, typically what we observe is frequently this leads to poor outcomes, in the sense that those who benefit from those regulation of prices are often not the intended beneficiaries, and the fiscal cost is huge, which means that you have to recoup that fiscal cost through other taxes, which could be actually more damaging to economic activity during inflation than the tax itself, than the excise itself. So think, for example, if you have to increase, as some countries are tempted to do, labor taxes in order to offset the cost, the fiscal cost, which could be huge, of reducing the excise on gasoline, right? So economically, this is really a suboptimal outcome, beyond the issues that you just mentioned, the health issues as well. So what we are doing as IMF in this area, I think one, it's and that goes to the collaboration issue later. Often we do these things in collaboration with others, but let me just speak briefly on what we do. So typically, we don't have specified programs for taxes. The way we do technical assistance in the tax area is extremely broad. It covers excises, the main broad-based taxes, the corporate tax, VATs, other consumption taxes, personal income taxes, taxation of natural resources, and increasingly taxes, climate taxes. So health taxes are actually just part of this, and they have received over the past 20 years a lot more attention than they did, let's say, in the 80s and the 90s. And here I have to say that a lot of what we learned in our analytical work and even our advice to countries actually come from Africa, because African countries were the first among many, many regions that introduced explicit excises, not an external tariff, not something embedded in how imports are taxed, but explicit excises when companies started bottling in the country rather than importing sugar-sweetened beverages from abroad. So when these important bottling operations started, these countries, rightly so, intelligently so, switched the tariff into excises on bottling. In almost the majority of cases we've observed over the past 20 years, it was a function of price. So entirely driven to raise revenue and not to address directly, at least, the health consequences of sugar-sweetened beverages. Now, this area, in our case, we do work on an annual basis in over 60 countries, 60 country projects in taxation. Most of it is demand-driven. Most of it is at the request of the country. In some cases, and increasingly so, we integrate the advice or the capacity development into IMF programs, obviously at the request of the country as well, because even if the IMF has a program and there's a lending, you still need buy-in, you still need to go through the discussion of policy priorities, whether countries can do it or not, and how the sequencing in time is done. Now, one area that is really big in our work, on which I think Sanya very nicely spoke, is we increasingly want countries to do that themselves rather than us doing it for them. And so we deploy extensive resources in building analytical tools, tax policy units at the Ministry of Finances, so they coordinate with other ministries. Manta, for example, mentioned the issue of health objectives and revenue objectives, with which I totally agree. But I don't think Ministry of Finances set policy entirely for revenue. I think they do actually consider a whole spectrum of things, including health issues, climate, etc. So we do quite a bit of this. So that includes revenue impact analysis, tools to do it, not only for excises, but also for VAT and income taxes. And in the area of work within IMF supported programs, or simply Article 4, surveillance, the capacity development strategy of the IMF since 2018-19 explicitly mentions the integration of these two. Now, we used to do it because it made sense, but now it's explicit, meaning that when we have a program, we will actually go through the whole tax system to see what best can fit the country for the particular program that they're going through, right? And sometimes certain things are more easily done than others, so priorities do matter. Country-specific situations matter a lot for the buy-in and for the political economy considerations. So let me stop here. Just in the interest of time, I'm sure we'll have other opportunities during the question period to expand a bit on this. Thank you.
Okay, thank you, Mario. I have lots of questions, but now let's go to where reality, where the rubber hits the road, which is tax administration. One thing is tax policy and the other is tax administration. And we're so lucky to have Karambu Mutora here to talk about that. You have been managing Kenya's excisable goods management system. It's known as EGMS, which was applied to alcoholic drinks and tobacco in 2013, and more recently to sodas and other non-alcoholic beverages. So I guess a question for you is, how has EGMS worked to tackle issues like illicit trade? Has it had an impact on tax revenues? And so what were the key factors that led to the results that you're observing?
Good morning. Kenya introduced the use of excise stamps back in 2002 on tobacco, and then later in 2007 on spirits and wines. So for the longest period of time, we used to have the paper stamps, which were just a sign on the goods that you'd find in the marketplace that taxes were paid on the products. But the information that was getting to the Revenue Authority through the returns etc. were not we could not verify it, as the stamps in themselves would not give the proper information in regards to the goods. So we realized that we were having a lot of illicit trade still. We were having switched declarations whereby a person has packaged a higher end product or imported a high end product and declared as something that is low end, thus attracting lower taxes in terms, not just in terms of excise, but also in terms of VAT and the corporate taxes. And therefore we had to do something about this. In 2009, we started doing some work to check whether we could get a system that would enable us get proper information in regards to the goods that could help us in terms of risk management, that the stamps would not be mute. They would give us the exact product in terms of brand, in terms of the sizes, etc. And therefore we'd be able to have forecasting of taxes. And therefore we introduced the EGMS, the Excisable Goods Management System, in March 2013. So first, we introduced on the goods that were already under an excise stamps regime. So we introduced on tobacco and spirits. So we phased out the old type stamps and successfully introduced the new generation stamps that were digital, brought up the aspect of declaring the usage online and registering the products also. And therefore we started getting the full information in regards to these products. Where we have automated systems, we did production lines, we actually did installations of equipment that would help automatically declare the usage and transfer information to the KRA databases. And therefore, things really changed for us. We had less products that we'd find that have anything fake in the market. We were not finding products that were not stamped, and the only areas that we would find illicit tobacco will be within the borders, like the border between Kenya and Uganda, obviously because our tax rates compared to the tax rates in the other countries in the region are quite high. And therefore it's very easy for someone to just cross the border and purchase a few things for their use or for selling in the kiosks within the towns near the border. In terms of, so the illicit trade in tobacco went down from 15% to about 5%. So for us, that was a huge improvement. And then we have 100% prosecution rate, because what happens is that the equipment that our enforcement officers have are able to have on the spot verification, and therefore it's not an issue of whether you had fake products or undeclared products or not. It's whether we will do the compounding within the Revenue Authority or we will take this person to court. In regards to spirits and spirituous beverages, in 2016 we had the president gave a directive on dealing with illicit trade in spirit, because that has been one of our biggest challenges, especially as far as the youth are concerned. And therefore, through a multi-agency, which means that we had different government agencies, from the Kenya Bureau of Standards, from the anti-illicit trade, the Director of Criminal Investigations, and KRA, we worked and ensured that we had fresh licensing for companies that were dealing with spirits. And what happened is that we had a reduction from 179 companies to 23 companies. And from that, we had an increase in excise revenue of 8 billion shillings. That's approximately $80,000 just from dealing with the 23 companies, which tells you that a lot of these other companies that were licensed were actually dealing with illicit trade. They were probably not declaring, and perhaps even some of the 23 that were left licensed and now under the EGMS now had to fully declare their revenue, which was really great for us. So in 2015, we managed to move to beer. It hasn't been it wasn't a very big challenge for us to go live on beer, because we just have two big manufacturers and very few other smaller companies, and therefore that was easy to deal, as most of their production lines, all their production lines were actually automated, so that was a smooth play. But we had a lot of resistance from the sodas and other sweetened beverages and bottled water. When we talk about bottled water, it's not just what we get in the bottle, but you remember that a lot of it is also sweetened, but still classified as water. So either way, there's a health issue on that. And then of course, the revenue aspect. So we had a lot of court cases and parliament interventions, etc. But finally, in 2019 November, we managed to go live with EGMS on these other products. And to our surprise, what our projections were in terms of our usage of stamps, we were more than 3 times the usage was more than 3 times. And of course, that means that also the revenue aspect within that period of time really went up. But then COVID came. And in March, which meant that we had less enforcement officers going to the field because we had to reduce the work in the market because of COVID. There was a closure of businesses and early closing of restaurants, only having takeaways and closure of bars, etc. And what happened is that there was mushrooming of kiosks with spirits. And when you have these mushrooming kiosks, it means that a lot of them have illicit products. So 2020 was a strange year, I think, for everyone. But we managed to get back to work and have enforcement activities go on, and things have worked better over the time. Revenue has gone up. We are surpassing our targets, which is a very good thing. In the year 2021, our collections were above our targets, which was really great for us. Now, the factors that have made this work well for us is that when we worked on our laws, on our regulation, on the excisable goods management system, is that we made sure that every person within the supply chain was made responsible for any products found in their premises that are not compliant. So whether you are a manufacturer or a distributor, a bar owner, or just a retailer, if you're found with goods that are not compliant, then you will be, the premises will be closed down. You'll either be compounded if you accept, or you'll be sent to court. We have many, a number of high-profile cases that are ongoing, and some of them are ongoing, their premises are closed. So you can see the impact that this would have on other companies, or do I want to find myself in the same place? Also, we've been working a lot as multi-agencies. So it is not just KRA that does checks in the market, but also we'll have the Director for Criminal Investigations, we'll have KEBS, and when you find an item is not compliant on either, because we're having joint enforcement. So if it's not compliant with KEBS, with the Kenya Bureau of Standards or KRA, etc., then it will be dealt with in that manner. And therefore, we've seen compliance levels really go up as a result. For us also, we know that just one way does not work. So for anyone to trade with excisable products or to access this EGMS system, first of all, you have to be licensed. So we are only dealing with taxpayers that we know. Any other person that we find with these products then is not supposed to be in the system. And therefore, we reduce the people, the players that we are dealing with in the market. We have also enabled everyone to be an enforcement officer by giving an application to the public within which they can check products before they consume and send reports to KRA. The police also use it. Retailers and wholesalers will not accept products in their premises before they have done the random checks to ensure that the products they are receiving are compliant, because of course they don't want to deal with KRA in regards of non-compliance. Also because of the probability of items on transit and on export being dumped in the country, any excisable goods on transit or export has to use the electronic cargo monitor tracking system. So you see, we have a number of ways of ensuring that we have more compliance in the market. We are glad that the countries next to us and who we have more trade with have also adapted a similar system. And therefore, we have been having talks of integration where we'll be able to exchange information on the products being manufactured or that are heading to Uganda. Have they really been received in Uganda? Have taxes been paid? etc. Have they left the country? And when you have this and integration of with the other KRA systems, then it becomes easier to monitor this. Thank you.
Thank you so much. What an interesting experience. And that the example of regional cooperation, if only they would set their tax levels in a similar way as well, because then there wouldn't be the difference in prices at the border. So anyhow, but thank you for that great example. And I think it shows how this is, even though this is a measure that has health effects, it really is not a health intervention in the sense of who does this, although upstream, we want the Ministry of Health to be very engaged, ideally in setting the design, or helping to set the design and levels of the taxes for the reasons that all of you have pointed out. So we have about 15 minutes left. And so one question I have, since we have both IMF and World Bank on the panel together, how would you see collaborating on this issue going forward? Are there opportunities to do, oh, it's 30 minutes because we go until 10:15, I'm being reminded. But how might the World Bank and the IMF work together on this agenda? And I think, one thing, Mario, you're raising, and this is true of the World Bank as well, of course, these are demand-oriented institutions that are serving country governments as clients. And these countries have very busy policy agendas, of course. How do you, analytical work inform some of the discussion about what gets on the program? But, increasingly we've been talking about, well, both the IMF and the World Bank have a role to play in highlighting these global issues that are important and where we'd like to see progress. How would you see future collaboration in this area? How to manage the, of course, no one wants to be supply driven, telling, it's not that one person knows what to do. As Sonia is also pointing out, there's a lot of contextual analysis that's very important here to design policies correctly. But, is there space to do something more systematically from regional institutions or from World Bank and IMF working together? And then I would ask our colleagues Sonia and Karambu to think about, what kinds of work have you done with World Bank and IMF in your work? And what would you want to see if you could live it over again? So go ahead, Mamta or Mario.
Thank you, Amanda. I would say that the World Bank and the IMF already work closely together on health tax policy. Actually, there's a UN interagency task force on NCDs that we both work on. And actually, I want to thank Mario for his real leadership on this issue. So I think this is an area where we have very good collaboration, and of course we should do more without a doubt. Sorry, and I forgot to mention the platform for collaboration on tax, which is the other forum where we all get together. This includes the OECD as well to strengthen the work that we do together on domestic resource mobilization, including through health taxation. I thought the other question that you had was very interesting, which is how do you generate a demand for this kind of work and in country? Because at the end of the day, as Mario was saying and Sanya was saying, you really need, this really needs to be owned by the country. It needs to the analysis needs to be very context specific, and this helps with communication and buying support. What I would say is that there's really two things that we can do as international agencies, the IMF and ourselves, as well as using these other convening bodies that we participate in. First, I think advocacy is and informed advocacy, building on very strong country examples, is extremely important. And this advocacy happens at many levels, and we should take advantage and make sure that this is heard. This is an issue that gets aired frequently in fora where a strong case can be made. I do believe that this advocacy does have an impact at the end. The second thing that we can do, of course, is to have closer partnerships with local organizations, think tanks, NGOs, etc., who are often very strong voices for these kinds of reforms. And thirdly, I would say that often there are champions within government, and making sure that we are fighting the internal bureaucratic battles to make sure that we can support these voices within government, reformers within government, with the analysis that they need, would be a third thing that we could do.
Nadia, thoughts? Or go ahead, Sonia. Anyone? Or Mario, would you like to come in on this, or?
Sure, I can. I have very little to add to Manta's nicely presentation on collaboration. Perhaps just to say also there's a macro level, the surveillance, etc., where there's quite a bit of collaboration on a number of issues between the two institutions, and that's strictly World Bank, IMF. Then you have the broad platform across agencies collaboration, like the platform for collaboration on tax. And then you have smaller groups like the health group, to which we are not officially a member, but to which we frequently participate and in terms of what we're doing, country knowledge, analytical work, etc. On analytical work, I'd like to say that and you mentioned that, Amanda, I think the three key publications that we have, which are useful, we call this how-to notes, how to approach certain issues. One on tobacco excises, one on sugar-sweetened beverages, and one on the issue of institutional aspects of all this and how countries build capacities to produce their own analytical work. On tax policy units. So these can all be found at the IMF website. And I'm happy to announce that just today we launched a revenue portal. So this is a portal on the IMF website where you can find all tax policy and administration work that we do at the IMF. So it includes tools, publications, collaborations, certain country reports where the countries accept to publish this. I would like to add maybe a few thoughts on to what Manta said. I think one issue that we struggle with a lot is to get the technical buy-in in a sustainable manner, meaning that a group of people within government who actually take a project forward in the medium term and make it happen. And in taxation, this could be long term. This could be many, many years. We often forget how difficult, for example, it was to do consumption tax reform in high-income countries back in the 80s and the 70s. And sometimes we expect developing countries to do that just in a couple of years. This is unreasonable. So what we need is sustainable structures within government who are to some extent independent of political volatility, that can take the technical work forward and seize opportunities for reform when the political environment is ready for it. I think we can do more on this. We put a lot of effort in this. Sometimes it works, sometimes it doesn't. In the tax policy area, one really big challenge is the structures in ministries of finance to deal with this. I mean, let's face it, tax policy in a lot of developing countries is still being made in so many poles without coordination. You have the customs administration, you have the tax administration, you have investment agencies, you have the Ministry of Economy, and you have the Ministry of Mines and Petroleum. And all this is, to a large extent, in many countries, is uncoordinated. And so you need leadership, technical leadership, not only political leadership, and this technical leadership needs to be credible. To make it credible, it needs to be perceived as independent of political changes. And this is where I think where Sania's comments on what you produce is what generates this credibility, right? What these units produce in terms of analytical work internally, not report that they asked the IMF or the World Bank to do, which are very useful, don't get me wrong on this, but what they produce internally is extremely important, even if it's just short policy notes, on which actually we also work, you know? How do you write policy notes for parliamentarians to explain an issue, its implications for the country, not just drawing a comparative table from elsewhere? So I think this, in addition to what Manta said, which is the civil dimension of this, the outreach dimension is also important. But for this outreach dimension to be effective, you need internal structures to be effective first. You cannot expect, you know, groups, for example, fighting in favor of taxes on negative externalities to succeed unless they have a credible partner within government. And in our view, that credible partner has to be first and foremost technical. It has to be, in our view, technical, most likely at the Ministry of Finance. It depends on countries, could be a combination, but you know, it makes sense. One last comment I would like to add. As you know, we fully support, increasingly so, and we've always supported the view that how taxes are designed is more important than the level of tax. And if you look at empirical literature, the combination of taxes is actually more important for growth than just the total figure, the tax to GDP ratio, right? And in this context, I think we need to be careful about what we mean by health taxes and the relationship to earmarking. And Manta mentioned soft earmarking, and there is hard earmarking. We don't want to get into the details of this now, but I think this could be, in a country context, it could be a slippery slope, right? If it's not well understood, it could be actually the beginning of a fragmentation of levies. I just give you a couple of examples. We've done a lot of work in maybe 20 countries or so, where earmarked taxes are in the hundreds, sometimes in the thousands. And these taxes escape entirely. You know, their individual amounts are not big, but when you put them together, they could add up to 2-3% of GDP, completely escaping the typical budget cycle oversight by Parliament. And so we don't want health taxes to become this. So I think we need to be careful in the messaging of how actually health taxes can contribute to, let's say, post-COVID recovery.
Yeah, those are great points. And I mean, you know, the other thing is an earmark tax is obviously cyclical. It can't be smoothed by the rest of budget. Ultimately, it's not great for the mission of some of those core programs anyhow. Sonia, you wanted to comment, go ahead.
I just want to make a quick point about you know, the earmarking of taxes, and then I just have a few things to say about what was discussed earlier. In terms of the earmarking of taxes, I completely agree with Mario that a lot of times there's a lot of lack of transparency in relation to the earmarking of taxes. So I mean, in my country, for instance, there is on your electricity bill, there is an earmark tax which supports the television corporation. And there may be many other bills where little bits and bobs are hidden, but how they're managed within budget books, how they're managed in the fiscal cycle, whether they are fungible or not, is something that evades analysis, that around which there's a lot of lack of transparency. So having an earmark tax without the mechanisms that compel its transparent utilization and accountability around its use and delivery is also a question mark. So while we make a case for an earmark tax and for it to be pronounced as policy and for it to go into, cascade into legislation and be passed through Parliament and the rest of that, the nuts and bolts of how those monies are managed within your budget books and your accounting systems is something that also needs very careful consideration and technical handling. So I just couldn't resist from my experience back in Pakistan to just agree with what Mario had said. Reflecting on what was said earlier about collaboration, I couldn't agree more. Because a lot of times when you are a policymaker and you are either formulating policy or you're cascading policy into an implementation strategy, or you're downright in the trenches implementing, you really have no one to compare your notes with, especially when you're doing something new and novel. You want to be able to reach out to your peers. And for me, that moment came in the last 3.5 years, several times, when I was doing COVID emergency cash, more recently when I was doing a program for digitizing grocery stores and implementing that program on a very fast track basis, I wanted to be able to ask certain questions of a peer in Egypt, in Nigeria, in Sri Lanka. And there really wasn't a structure to enable that. Collaboration and exchange of knowledge does not happen in thin air. There are mechanisms and structures to enable that and foster that and shepherd that and provide the cadence and the opportunity and whatever else goes within meaning. Now, as a government functionary, a lot of times you want to go to platforms that have been established by non-governmental entities. And there are credible non-governmental experience sharing platforms, but then you are sworn to secrecy, by virtue of a number of different frameworks as a government person, and cannot share information and insight on an NGO's platform, which by no means that they are not secure. I come from that background myself. And in fact, that was the impetus which lent me and our mission in New York to speak to colleagues within Mamta's groups, asking them to help facilitate the creation of a social protection platform, which would enable peer-to-peer government exchange of knowledge and expertise, and would create the how, and would enable sharing of the how-to tools that Mario just referred to. I'm just trying to make a point that collaboration has to be facilitated. And of course, it's some of the apex international agencies and multilateral fora which engage with governments, whose mandate is to engage with governments, who are best suited to do that. And just to sidestep on a slightly different point, but that also came under discussion. And I just wanted to lend my voice of support to that, the point about the policy vacillations that are inherent to change in government. Incoming governments do not want to be seen as furthering the work of a previous government. That is a worldwide phenomenon. And what falls through cracks in that process is really tragic. And I don't want to go into the details of, but a lot of times you do not have that technical base, that very credible technical base. And if you have that credible technical base, it is very politically aligned. And with changing governments, those things just fall through the cracks, and you start all over again. I mean, as far as I'm concerned, you can put the worst reform in place, but if you are committed to policy continuity and committed to learning from evidence and making modifications, the worst reform will bear fruit. But if you put the best reform in place, And if you will not have policy continuity and will not have the commitment to learn from evidence, or will not have the evidence base to learn from, then we will just keep on going in circles. And in many developing countries, you see that phenomenon. For the one government comes, puts something in place, the next one installs something new, the third one gets everything out of the window. So we really need to do something fundamental with the way governments work, with the way they deal with evidence, with the way policy is continued, with the way we ingrain the safeguards of good programs within government systems within developing countries for them to have an impact. Otherwise, we will just keep going on circles.
Yeah. Thank you, Sonia. And I think, well, you suggested to us maybe a community of practice on implementation with governments, which I think is an interesting one. And then I think your last point really speaks to what Mario was raising earlier as well, about the importance of having internal structures within ministries of finance that really are these kind of independent technical voices, and not have it be characterized as an advocacy effort or something that is the administration of the day, and that therefore the pendulum would swing to the other side and we would lose progress on this. So very, very well noted. Karambu, I think understand that you're involved in a health tax work on the UN tax committee. I wondered, well, feel free to respond to the initial question about your interaction at the Kenya Revenue Authority with the international agencies, but also this other work going on at the UN. Go ahead.
So I think the interaction I have had recently with IMF is on the MRTS, where we are working on the medium term. What the work we've done so far is we've had meetings with IMF, and we are waiting for their reports so that we can now engage on this side. And my feeling during those meetings is that the persons from the IMF side need to do more homework on what really is on the ground, because of course some of the things that may be suggested sometimes leave you wondering, like, has this person come to the ground and know how the things really function here, and can this really work here? So I think maybe what they need to do is to involve people who have been involved in the technical aspects in countries that have that are almost similar when working on some of what they are asking you to implement. On the UN subcommittee or work, we've had a few meetings, and it's just during the last week that our work was approved for us to continue. So there isn't so much that I can offer on that right now. But I really look forward to doing that work. I'm involved in writing on the tax administration chapter, together with the use of systems to further that. So and I really look forward to see us complete the handbook we're working on right now. Yeah.
Okay, that sounds interesting. Others, do you want to respond to what you've heard from Sonia and Karambu, or?
I'd like to make a couple of points. In this discussion, we focused on taxes on alcohol, tobacco, sugar-sweetened beverages. But I guess we should also think of fossil fuels and carbon taxes and fossil fuel subsidies because of the huge impact that unclean fuels have both on health and the broader impact of the use of fossil fuels on health. So I think there's a broader discussion that's worth having of the impact of carbon taxes and fossil fuel subsidies on health, and that is something that I think governments should think about. I also want to come back on this earmarked tax issue. I fully agree all the issues that were raised, lack of transparency, the rigidity it brings to the budget, the fact that it can add up to a lot. So the point that I'm trying to make is that if you want to make some of these taxes palatable, especially taxes on tobacco, less to some extent, less on alcohol, particularly on tobacco, which is very heavily consumed by low-income households in most developing countries. Part of that is to point out the health benefits, and part of that, in my view, could be around talking about the use of these tax proceeds for the benefit of better services for the poor. That's what I meant by soft earmarking. There's a way in which it can be presented to make it more palatable, and it's very important to think about that, because the reaction to tobacco taxation in particular is sometimes rather negative.
Yeah, exactly. I think that kind of wide framing, and I think Sonia also earlier raised the safety net and compensating through the safety net, which is and cash transfers and things like that is also interesting as a political management tool when these kinds of consumption taxes are introduced or increased. Can I also go back to you on Mario on the point that Mamta is making, that health taxes, there's a lot of coverage on the IMF website on carbon taxation and carbon pricing. Of course, and the sizing of the potential, the consumption effects, the revenue yields are, kind of similarly, they're smaller with these other kinds of health taxes, but they're still important. And I guess one question to you is, why not the same profile for the tobacco, alcohol, sugar-sweetened beverages as for the carbon pricing taxes? I mean, one is, addressing the climate crisis versus the health crisis, but, could we do both? Could we treat them very similarly, or is that accurate? What would you say about that?
Well, that's, I mean, we did, if you think, not narrowly speaking on the tax part, but broadly speaking, in the past 3 years, the IMF has very much oriented its intervention in countries, particularly in terms of funding, towards helping countries dealing with the COVID situation and planning better for the future. And climate taxes, or the climate agenda, comes, together with that, right? I mean, Mamta is absolutely right. This is primarily about health, even though we think of it as climate and green, but it's really about the health of the world's population. So maybe there is a presentation issue, but frankly, we don't. I don't think it's fair to say that the IMF hasn't presented the health issue in the same way as climate. It is true, though, I agree with you, that the impact of the COVID pandemic, both human and economic, has been such that the messaging may be perceived as, commensurate with the timing of the pandemic, that, we're getting out of the pandemic and there's a huge emphasis now on climate issues rather than health issues. But I don't think so. And even recently, our MD mentioned additional funding programs for low-income countries with very little conditionality, primarily, focusing on the health. Now, I do agree with you that when you talk about the taxation of sugar-sweetened beverages, it's not like talking about the taxation of fuel products. Sweet stuff cater for the stomachs, fuel products cater for energy and vehicles, and it's much, 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 much bigger than anything we can even imagine in terms of taxation of sugar-sweetened products. So there's, I guess, a recognition that if we speak only about mitigation in the climate area, which is primarily about taxes, right? The carbon tax and some more what we call fee-baits, which is this balance between encouraging and punishing certain activities. I think it's big, and we expect that it would stay with us for a very long time, for the next few decades. But I do agree with you that the message may seem a bit out of balance, because health taxes also, let's not forget, are difficult to define. You know, what is a health tax? I think Mamta is absolutely right to say that climate taxes are also, to some extent, to a large extent, health taxes. Interestingly, in the UN group, we recently had a discussion precisely on that. Should the group actually discuss or include, to some extent, the green taxes, maybe not the whole climate agenda, because it's very, very broad and it includes adaptation, but at least the tax side of it, should it be? And, you know, participants had different views on whether this should be done or not. But I think conceptually, it's absolutely right to consider, you know, at least certain energy consumption, particularly fossil fuel, as directly related to health issues.
Okay, well, thanks to all of you. We're at time now, but I hope we can come back. I think, you know, one thing Karambu mentioned that is, you know, really how enforcement had difficulties during the COVID-19 period in 2020, and that in 2021 there has been recovery and enforcement. I bet that a number of countries have been struggling with some of the same issues, and I know that IMF and World Bank will be working hard to get all of that back, because we certainly don't want to lose ground. You know, we'd love to see tax levels rise to truly be corrective on the negative externalities that are generated by the consumption of these products. But what we certainly wouldn't want would be to lose ground all the progress that has been made. So with that, I will end. Thank you so much to all of you to joining. Count on us if you have ideas for CGD work in this area, things we can do to support all of you and make sure that your good work is getting attention. Anyhow, but thanks to all of you for joining us, and we'll be in touch, and thanks to the audience. Bye.
Bye, everyone. Thank you. Great discussion, Amanda.